So, why does your thyroid medication make you feel worse after you take it? Well, there's an explanation as to why that might be the case, and it is called receptor resistance. Now, what does that mean? Receptors are found throughout your body, and receptors are there to accept the hormones that your body's producing so that your cells can work the way they should. So let me just explain, or by the way, my hand and a block. Let's say my hand is a cell, right? Okay, and this block is a receptor, right? And it's attached to the cell, basically. That's a simplified version. Let's say this here is, this purple block is a thyroid hormone that you produce out of your thyroid gland, okay? And it goes out, it gets converted, and it's a thyroid hormone. It's active. So it floats around in your bloodstream, and then it finds a receptor, and it attaches to it. So then my cell then can do what it's supposed to do, which is my hand. That's how receptors work. And that's how our body works with hormones. Now, receptor resistance is a problem with that activity. And medication doesn't help that. Actually, medication can actually hurt it. Now, what happens is there are three things that can interfere with the thyroid getting to the receptor so that your cell can work the way it should. One is too much thyroid hormone. So an example is if you've been taking Cytomel, or your thyroid medication has increased and suddenly you feel worse. Why are my symptoms worse after taking the medication? Or you have rapid weight gain. In other words, you've been gaining weight, let's say for instance because you're hypothyroid for quite some time, but all of a sudden your increase in thyroid hormone, all of a sudden you gain weight rapidly, like within 4 weeks, all of a sudden unexplained. The other problem is that, say for instance, you've had hair loss for a long time, and all of a sudden, after taking Cytomel or increase your medication, you lose hair, poof, like rapidly, like within a couple of weeks or so, or 4 weeks. Those are signs that you could possibly be having receptor resistance. Let me explain how that works. So here, let's say we have two hormones, thyroid hormones, floating around, and they're trying to get to the receptor, you see? So what happens is they try to get the receptor, but they're kind of preventing themselves from getting there, and also the receptor itself sees too much hormone, and it says, oh, I don't want that. I'm going to shut down. I'm not going to let them get to me. And it's a way that your receptor does it to survive because the receptor can't take too much hormone. Let's look at an example of plants. Now we know that plants need water to live, but too much water will actually kill the plants. The same goes with receptors. Receptors can't handle too much hormone. And that could be the problem, where taking more medication can actually be shutting your receptors down, which actually makes you more hypothyroid than you already are. Now, there's two other instances where it can interfere with receptors, and I'm just going to touch upon them a little bit, and then we're going to talk about what you might be able to do about those types of things. The other is, let's say you are under a lot of chronic stress, and I'm going to talk about stress later on, but in another video. But in this one, let's say this is a hormone that we call cortisol. Now, cortisol is released under chronic stressful situations. Now, cortisol can actually come along and bump off the hormone and prevent it from attaching to the receptor. That's what cortisol can do. The other hormone, or the other types of hormone, is if you have any kind of chronic inflammation going on, an autoimmune disease, chronic diabetes for one, you produce something called cytokines. Cytokines are another kind of immune hormone, so to speak, that actually can bump off the thyroid hormone and prevent it from getting attached to the receptor. So those are two other ways that receptors can be interfered with, which I'm going to talk about later. But for the purpose of this video is we're talking about receptor resistance, where you have too much hormone. So how do you deal with this? What do you do? Well, you got to talk to your doc. You got to say, Doc, you know what? I think I'm taking too much hormone. Can we cut it back and see how you feel? Because if the reducing of the hormone that you're taking makes you feel better, then yeah, you have receptor resistance. So to live better, eat better, and be active better.